Thank you, Mr. Chair, and thank you, Secretary Becerra, for being here. I'm just going to start this by saying that I'm a physician and also former director of the Iowa Department of Public Health. In part because of the Biden administration's deference to the teachers' unions, the CDC's school reopening guidance suggested a far greater risk to reopening schools than actually existed. As a result, many students stayed at home far longer than they should have. 1 year later, the devastating impact of the Biden administration's unwillingness to challenge its political allies is clear. And let me state that in Iowa, our schools opened to in-person learning in August of 2020. And in Nevada, as I've talked about in this committee room before, Nevada reopened its schools at the top of 2021 because between March 16th of 2020 and June 30th of 2020, 6 students committed suicide, and between July 1st of 2020 and December 31st of 2020, an additional 12 students committed suicide, the youngest of whom was 9 years old. So we know that the policy of keeping schools closed not only was detrimental to learning, detrimental to child poverty, to nutrition, to reporting of child abuse, but it was also detrimental to the lives of these children with the lack of interaction with other students and with their teachers. Just last week, the CDC released a survey data showing increased rates of poor mental health, substance use, emotional abuse at home during the pandemic. Learning loss has also been dramatic, as I said, and the World Health Organization anticipates that childhood poverty will have increased by 15% and will take decades to recover. A National Bureau of Economic Research report late last year found that remote learning contributed to highly significant learning loss with much less pronounced drop in scores among students who continued to attend school in person. Secretary Becerra, looking back on the last year, do you wish your agency would have shown more courage in standing up for children who desperately needed to be in school?
Congressman, first, some of the statistics you mentioned are just devastating to see when children die, and we've been talking a little bit about the stress that families are feeling, so thank you for pointing that out. I will tell you that whether it's through the CDC or whether it's through the FDA, in moving forward on COVID, we've tried to do the best we can based on the science and the evidence. And in protecting children, we want to make sure that we use the best science and the evidence. And the CDC has consulted with numerous stakeholders, whether it's teachers, principals, whether it's education experts, whether it's those who have run departments of health or education before. What we do is use the best guidance we can from those experts and the evidence that's before us with the science to make the decisions. And I think as a result, today, virtually every child is back in school.
So you don't have any regrets that your agency and you did not show more courage in standing up for children. You mentioned the number of deaths that had occurred in children. So do you know how many children have died of COVID-19?
I know it's in the hundreds. I don't have the precise number because obviously it changes as the days go by.
And are you aware that the CDC revised downward the number of deaths that have occurred in children from COVID-19?
The CD is constantly trying to make sure we use the most accurate information available, and so we should surprise no one that we're trying to make sure that the public has the best information possible.
So the American Academy of Pediatrics just published in March that 0.00% to 0.27% of all COVID-19 deaths in children. That's the percentage rate. And for that, we're willing to create masks in children in the Head Start program or other programs that we know lead to learning loss, lead to loss of communication, lead to detriment in their learning in order for what scientific guidance?
Congressman, I have 3 daughters. I want to make sure I get to see my 3 daughters and they get to see their father pass away instead of me seeing one of my daughters pass. We will do everything possible to make sure no parent sees their child die.
0.00% to 0.02% of all COVID in children has resulted in death. But yet the learning loss is significant. It is permanent. I have children. I care for my children. I am vaccinated. I have given vaccines. The risk for children to transmit COVID-19 because of their immune system is extraordinarily low. Who exactly are we protecting? When we had programs that would mandate that teachers went to the top of the line, as it should be, so that they would reopen schools, but to continue a policy in children that's detrimental to their speech, to their learning, to their ability to progress in this country, in the most critical years of their lifetime is a policy that should not be imposed upon our children. Thank you, Mr. Chair. I yield back my time.
Thank you. The